Hey, cuz. Okay, so I consistently get asked a question because I'm doing a lot of community education, right? And I think a couple of weeks ago I reached almost 100 people just through community education, and I'm back out again starting next week out in the public. And a question that I consistently get asked is, what do you do for back pain? You know, and I get it. You know, it's like 80% of the population has back pain at some point during their life. It's like 84% of the population. So back pain is it's going to affect almost everybody, right? Now, when somebody asks, you know, what do you do for back pain? It makes me think that people believe that there might just be like a magic potion or a magic pill or a magic exercise, and it doesn't work like that, right? If a one-size-fits-all approach were to help just back pain in general, let's talk about back pain for a second. Okay, so what we know about back pain is that roughly 10% of all back pain is diagnosable, which means that, you know, it's coming from either something sinister, you know, like cancer. In 1% of the cases, you know, it's very small. It's a little bit less than 1% of the cases. It's very small. Or it's something that's obvious on a radiograph or an MRI. You know, you have nerve root issues, you have a fracture. You know, those are fairly obvious deformities that we can see. But with that, roughly 90% of people who have back pain, we can't tell you exactly what's causing your back pain. The question is, does it matter, right? Because we may not know the exact tissue at fault or the multiple tissues that are working together to cause your back pain, but we can start to figure things out through movement. And when people ask me, you know, what do you do for back pain? It's almost like a canned response at this time. Well, I evaluate you, I figure out what makes you worse, and then I figure out what makes you better. Because not everybody is the same, you know, and I teach this stuff to PTs, right, throughout the country on one of the other pages that I work with. And I'm just going to throw out a couple of stats, right? Anywhere from 49 to 64% of people are going to respond to one exercise. You know, it's an easy exercise, but it's only one exercise. But then when we look at that, you know, roughly 8 to 10% are going to respond to a different exercise. And then roughly 4% are going to respond to a different exercise. And then out of all the patients that walk through the door, 20% of them aren't going to respond to any of those exercises. And so the easiest thing to say is when you come into the clinic, you're going to be evaluated in order for me to figure out what's the best method for treating you. Now, if every patient responded to the same exercise, then all therapy would be successful. Right? And we know that's not the case, right? And I know that's not the case based off of my own career, because when I first started, I was helping maybe 50% of patients with back pain, and I was missing a lot. And I still see therapists that are missing a lot with back pain. Nowadays, I'm probably sitting at about 90%, where there's very few patients where I can't help. It may not be turn off their pain immediately, but at least help them to figure out how to get better over the course of time. With about 80% of those patients getting relief within that first 1 to 3 visits. So to give you a basic answer for what do I do for back pain, I evaluate you. I make sure that I find what makes you worse. So it's a thorough history. I want to talk about that for a second, because I'm hearing stories from some of the patients that are walking in, you know, where they're not quite sure who their therapist is. That continuity of care is extremely important. So if you're going into PT, you want to try to see the same therapist when you go in there, because that therapist is going to have a little bit more of a handle on your symptoms, I hope, if they're talking to you and trying to figure out whether or not therapy's helping you. So those therapists are going to have a little bit more of a handle on your symptoms, and you won't have to keep explaining yourself each time that you go in. The other thing that I just heard from a patient was the patient went in for the session, and the therapist spent 10 minutes with her out of an hour and a half. Okay, that's, I just told you what I'm going to do for your back pain, right, is evaluate you and determine what makes you better and what makes you worse. There's no way for me to do that if I don't talk to you. Okay? And so what you can expect from a physical therapist is that they're going to communicate with you effectively. They're going to try to figure out why you're having pain. And why you're having pain, we just talked about, only 10% of cases are truly diagnosable based on a tissue-specific level, right? Meaning that we can say, it's because of this that you're having pain. And so if we can't nail down the exact tissue that's causing you pain, then at that point, we need to figure out why you're experiencing your symptoms. which movements are causing you pain, which postures are causing you pain, which positions are causing you pain, and teach you how to avoid that for a short period of time in order for you to progress back to that at a later date. Thanks for watching. This is Dr. Vince over at FTR in Joliet, now a part of the Good Life family. I just wanted to touch base for a question that I'm commonly getting out when I'm out speaking in the public. It's not a cookie cutter answer. Nothing ever is really, unless you have a protocol that you're following post-surgically. But nothing is ever really cookie cutter. When you come into therapy, your therapist should try to figure it out. And that's what I do for back pain. Have a good day.